Thank you, Rohit, for inviting me again to have this symposium, and thank you, Dr. Ryan, for the introduction. So I'm Takoua Brahim. I'm a child and adolescent psychiatrist. I'm actually working in France at the University Hospital à Rouen, but originally, I'm from Tunisia, and I used to work at the University Hospital Fatouma Bourguiba in Monastir. So today we'll be speaking about maternal and child outcome, a general overview. It's the first presentation of the symposium, and it will be the introduction of the topic. There is a two part, so I have no conflict of interest. I will introduce the topic and will illustrate it with some of our research. And before starting, I like this statement by Donald Winnicott, a pediatrician who also is psychoanalysis. In the earliest phase of pregnancy, we are dealing with a very special state of the mother, a psychological condition which deserves a name, such as primary maternal preoccupation. With this statement, we have the focus on the importance to be careful with maternal mental health even before the child is there. So, why we should talk about maternal mental health? Because we are addressing not only a single person, but it's a group of people: the mother, the father, the child, the family, and even the society. Second, the pregnancy, the delivery, the birth, etc. Really, what do we know? How the mother really live all this transformation? How the little child live in the first month, how it affects her development. So we know a little, but surely there is many other things to discover. Second, maternal mental health varies greatly depending on cultural representation, the narcissistic investment of the mother, the child, the father, even the society, the economic challenges. And we know that the present, the past, and the future influence the maternal mental health during pregnancy and after. So what we know most is this side of the mother. The most magically day of my life was the day I became a mother, but it's not true for all mothers. There is also many of them that are dealing with many difficulties, and for many society and for many culture, it's like a taboo to speak about a difficulty of a mother to have to love her child, or difficulty to take care of the child. So many mothers will not speak about it, and it will be very complicated for them to go further. So we will speak about the mother perspective. From the mother perspective, pregnancy is a life-changing event. And the life events are changing, will change the pregnancy experience. We know that there is many studies addressing the history of trauma or child abuse or child sexual abuse in mothers, and how they are living their pregnancy, parenting, and how they adjust with their child. This study is a little bit old, but it still have an actual indication. So we find that child sexual abuse has a long-term repercussion for adult mental health and parenting relationship, which mean mother that has experienced child sexual abuse will have more difficulty taking care of their child and have difficulty with their own pregnancy. Emotional distress and prenatal attachment. This study emphasized that pregnancy loss was associated to depressive symptoms in both mother and father, couples difficulty, and there is many divorce and separation that come after pregnancy loss, difficulty with rearing the child, and lack of early interaction. The child that is born after a pregnancy loss, it was have some difficulties, or the mother have some difficulties taking care of this child. This is only some of what we know about the impact of previous life experience and the pregnancy and interaction between mother and child. Pregnancy and the technology, we experience more and more advancing in the technology during to control the mother health during pregnancy. Is it always good? The effect of stress. This study addressed the effect of stress and anxiety associated with maternal prenatal diagnosis on fetal-maternal attachment, and what they did find that prenatal diagnoses such as prenatal screening for chromosomal abnormalities are associated to maternal anxiety during and even after the childbirth. So, is it better to know or not to know if the child have problem or if the fetus have growth problem? In this study, fetal origins of mental health, the developmental origins of health and disease hypothesis, it seems that there is a relationship between the fetal growth and the mother mental health. And it seems that, and we know that mother with psychiatric disorder will have children with more risk of prematurity, more risk of low weight at birth, and it seems that even regarding in the other the relationship is also correct in the other sense. It means that when there is a problem in the fetal growth, the mother mental health will have some complications with more anxiety and more depressive symptoms. Parenting stress and first-time mother of twins and triplet conceived after in vitro fertilization. There is many study regarding the mother mental health after medical assistant pregnancy, and there is a more frequent anxiety and depressive symptoms with this population. So it seems that the new technology have some impact or an important impact on the how the pregnancy and how the mother are living this pregnancy. Pregnancy and psychiatric illness. For some, just to say that historically we did have the idea that maybe the pregnancy are a time that will be mother will have less problems and less less episode of psychiatric illness when they are pregnant. But the new study find that no, there is more episode of bipolar disorder, more episode of schizophrenia, more episode of depression and anxiety during pregnancy than outside this period. And what will be mediate the risk between maternal schizophrenia, for example, and adverse birth? It could be the risk of psychiatric complication. As I said, there is more risk of a new episode of schizophrenic disorder or bipolar disorder during pregnancy. So there is more drugs that will be used due to this relapse, and there is an influence of these drugs for a principle on the neurodevelopment of the child. The psychiatric illness also have impact on the ability of the mothers to take care of the child. I remember a mother taking care of a mother who has schizophrenia, and it was not his schizophrenia that are impacting his ability to take care of the child. It was the drugs. She has a very high dosage of antipsychotics, so even taking the baby in his arm was difficult, and it was a source of depression for her. So and the ability to recognize being pregnancy, we have many, what we say, pregnancy deny, mother who didn't know that that they are pregnant until uh, very late stage of pregnancy, like 30 weeks or um, even later. I remember a mother that discovered that she was pregnant when she was giving birth, and she was with bipolar disorder and many other possibilities that relate psychiatric illness and the possibility of complication of the development of the child, the development of the binding between the mother and her infant, and so the other risk on the family and society. This systematic review have found a very high prevalence of perinatal depression, it was 60%, which is higher than the prevalence of depression in the general population. And we have a prevalence of anxiety disorder between 20 and 40%, which is like approximately one for every two women will approximately experience anxiety disorder during pregnancy. So screening for depression and screening for anxiety are highly recommended by the majority of the scientific society and should be added in the follow-up of the mother. There is on many other factors that are responsible of difficulties during pregnancy. Psychological difficulty of the mother during pregnancy. It's a change in his lifestyle, in her lifestyle. Also, there is many modification in the physiological functioning and even in the how her body looks, and with all the new how we say it in this in the actual society, the aesthetic of a woman is very important. So mother and women are more aware of their bodies. So many more and more in my daily clinic, I receive moms that are having difficulty because the changing of the shape of their body. So maybe it seems trivial, but it's important for them. It depends also on the quality of social support. So it's important, and we find that there is a high correlation between maternal depression and the lack of support by her partner. Social precariousness, there is more depression, anxiety, lack of good binding between mother and infant, with women that have that are isolated socially and economical status also. So this was the perspective of the mother and the mental health. If we see things from the child perspective, so the outcome for the child and the relationship with the mother, We have many studies regarding anxiety and depression during pregnancy and the early months of childhood and the outcome of this childhood. So this study find higher maternal prenatal anxiety in the early stage of pregnancy, 13 and 17 weeks of gestation, was more associated to what we call difficult baby temperaments, which is related later with externalizing disorder, for example. Maternal anxiety during pregnancy was also associated with lower developmental score at the age of 2 years of the child, and there is even a study that goes till the age of 7, when we have more difficulty at school and more difficulty and more rate of ADHD, for example, and anxiety disorder for these children. High antenatal maternal anxiety is what we said is related to ADHD symptoms, externalizing problem, anxiety at 8 and 9 year olds. So, in fact, it seems that it's only during pregnancy, but the impact seems to be life lasting for the child. And more there is a mood disorder for the mother or anxiety, the more the child will have difficulty regulating emotion and having all the complication of this dysregulation emotion related to. And it seems that when the problems are, when the anxiety is coming at the early stage of pregnancy, it have a long-lasting complication in the child development than when it comes at the end of the pregnancy. It has even difficulty regarding motor skill development, intelligent development, and even more conduct disorder and psychopathic traits for children that have a mother suffering from anxiety and high prenatal stress. In general, we have more association between all psychiatric diagnoses for the child, especially mood disorder, when there is maternal stress during pregnancy. I will be more focused on prenatal attachment because it's the hypothesis and the that I am working on actually. And it could be the link between all these maternal problems and the outcome of the child development. For example, we did find that mother's depression predict a worse emotional involvement before a childbirth, while mother anxiety predict worse emotional involvement with the infant after birth. So, in fact, depression and anxiety will influence the interaction between the mother and the child, and so the quality of attachment. And we know that the quality of attachment is related to the development of the child and development and the risk of psychopathology and psychiatric disorder. We did find also that we did see that child abuse impact the mother capacity to take care of the child and to rear a child. It seems that even there is intergenerational transmission of trauma, and this transmission will be through prenatal attachment. So I will go to the two study that we have, and there is a third one actually I will just introduce it at the end. So the first study we conduct, it's regarding prenatal attachment and obstetric outcome in a sample of Tunisian women. So the aim of the study were to determine the impact of pregnancy factor of the quality on the quality of prenatal attachments and how the quality of prenatal attachment can influence the obstetric outcome. So we used a prospective correlational study, including 102 women, and our major outcome was a prenatal attachment inventory. We included all the mother that was consented to participate. So we evaluate at 5th month and at the first 3 days after birth. And what we found that there is a correlation between maternal factor and the quality of perinatal attachment. The higher the age of the mother was, the worse the attachment was. Mother that have many pregnancy have less quality of attachment, many periods also. No correlation between abortion, no correlation between the age of onset of sympathetic sign. The correlation was primarily number of live-born children. When it was the first child, the quality of perinatal attachment was better. And there is also a correlation between gestational diabetes and pregnancy toxemia with lower perinatal attachment score. No relation with the outcome, obstetrical outcome, pregnancy duration, child birth at weight at birth, and etc. And for the second one, it was for the impact of maternal prenatal anxiety on infant socio-emotional development at 18 months. It was conducted at l'hôpital Pitié-Salpêtrière à Paris. And we conducted evaluation at third trimester of pregnancy, first 3 days, and the development at 12 and 18 months. And the results, what we found, it was that the higher the score in the trait anxiety, the higher the defiance and relational defiance and aggression at the 18 months. The higher the score of impulsivity also and externalizing symptoms in the child. And we found also a higher score, especially attitude regarding food, but there is no real correlation with dysregulation or sleep or negative emotionality. With the trait, but there is with the state of anxiety. The trait, it's when the mother, the difference between trait anxiety and state anxiety, the trait is when there is only anxiety for a reason during a real limited time during the pregnancy. The state, it's when the mother has previously anxiety disorder that are exaggerated or relapsing during pregnancy. So it was more the state anxiety that was related to dysregulation, emotional dysregulation with the child, with eating disorder, negative emotionality, and difficulty with compliance. And this research were conducted with a group of both hospitals à Rouen et à Paris. And we are actually conducting a third study to intervene with mothers that are at high risk of developing disorder, binding disorder between the mother and the child. We will be having a psychotherapeutic intervention during the last trimester of pregnancy, and we'll see if we can um, prevent developing depression and prevent developing binding problems. So to conclude, dealing with maternal mental health means dealing with a newborn child, a sibling, and the entire family and society. The first step in the primary prevention of later psychiatric disorder. The pregnancy is a life-challenging step in the life of the woman, so we should accompany the woman during this period, and giving birth is not a giving. Be aware of the consequences. Thank you for your attention, and my email address if there is any late question. Thank you.